Hello everybody, I am Dr. Puneet CS, consultant neurologist at Sri Gokulam Hospital, Salem. Today I will be talking on insomnia or sleeplessness. So insomnia is insufficient sleep, quality as well as quantity. So it can be in the form of abnormality in the form of initiation of sleep as well as maintaining the sleep as well as early awakening from the sleep. So insomnia is broadly divided into a short term insomnia as well as chronic insomnia. This short term insomnia is usually associated with stresses like loss of loved ones, divorce, loss of job, and usually it lasts for days to weeks. Whereas chronic insomnia is any insomnia which lasts beyond 3 months. Usually patient will have insomnia or sleeplessness for more than 3 days per week, lasting for more than 3 months. Usually chronic insomniac patients will have insomnia for a long time. Many patients will come with disturbed sleep for many years. They will tell the doctor, I have disturbed sleep for many years, and they will have other comorbidities also. So most often this insomnia is diagnosed whenever it causes some abnormality in daytime activity. So like we don't come across a sleeplessness or insomnia patient just because he is not able to sleep, because that should have some effect on day-to-day activity. So daytime activity, if the patient is feeling fatigued, malaise as well as poor attention, patient is having judgmental errors, whereas behavioral disturbances, mood disturbances, then definitely patient needs to be treated. Otherwise some patients are there who have only sleep for 4 to 6 hours. There also will not complain anything if they don't have any day-to-day abnormality. Like daytime they have no abnormality, means it need not be treated. But if patient is having insomnia or sleeplessness, but daytime activity patient is having some abnormality, definitely it has to be addressed. Most often this insomnia coexists with many medical disorders. So the most common disorder being psychiatric illness like depression, anxiety, post-traumatic stress disorder, and also chronic medical disorders like chronic lung disease, chronic heart failure, cerebrovascular disease, patient with connective tissue disorders, patient with rheumatoid arthritis, connective tissue disorders, chronic bone problem also can have insomnia. Patient also are insomniac in patients like they take lot of medications that hamper sleep architecture. Most often an average adult goes to sleep within 10 to 20 minutes after going to the bed. So within 30 minutes or 20 minutes patient will be asleep, whereas in patient with insomnia, patient takes more than 30 minutes and will have multiple awakenings in between the sleep. So a patient will have initiation of the sleep abnormality, as well as after the patient is asleep, patient is having difficulty in maintaining the sleep. So always this is associated with lot of daytime abnormalities like fatigue, malaise and all. So any patient who comes with all these symptoms, we address one is clinical history as well as some investigations like polysomnography, wherein we see the sleep architecture, when is the patient sleeping, at what this one part of the sleep cycle he is waking up, and address it accordingly. Along with that, we also treat the coexisting disease. For example, patient is having a heart failure, means patient has to be addressed first. Along with that, insomnia also be addressed separately. We evaluate patient with insomnia in the form of sleep lab. That is a advanced lab wherein the recording of the electrical activity of the brain in the form of EEG is taken. We see for various waves which contribute to various cycles, part of the cycles of sleep, and along with that video camera will also be placed, wherein any patients with epilepsy can also have insomnia, wherein we will also have an idea. Along with that, the disorders like sleep apnea, wherein the pulmonologist have a role, also can be detected. So the various disorders can be detected. Along with that, we also, some patients like neurological disorders can also have insomnia in the form of brainstem lesion, because there is a particular part of the brain which is subserving the sleep architecture. There also, if it is there is damage, we can detect lesions like any tumor or any damage to the particular part of the brain also can be detected. Along with that, we also have biochemistry like thyroid disorders can also present with insomnia, and patient with chronic diabetes because of the autonomic instability can also have insomnia. So many other disorders are there, needs to be evaluated along with the proper polysomnography or test in the sleep lab. So whenever we come across a insomnia patient, we treat them with both medical management as well as non-medical management. In treatment with insomnia, non-medical management is paramount. So what is non-medical management? We always tell them the proper sleep hygiene. So what is proper sleep hygiene? Patient should have regular bedtime, regular nap time and regular rise time. So for example, patient should be sleeping at 8 p.m. to 10 p.m. like that. So there should not be erratic change in the regularity of the sleep cycle. Patient should not have the napping, like for example, patient they develop habit of taking short naps in the daytime, like after lunch they will sleep for half an hour or 1 hour. That should not be done. Patient should not take coffee beyond 2 o'clock. They say that caffeine hampers the sleep architecture. So beyond 2 o'clock we should not take coffee. Along with that, better to avoid alcohol and smoking, and patient should avoid larger meals during supper and dinner. Patient should also have a proper sleep environment. It can be in the form of darker environment and as well as quiet. Should be quiet, and the use of gadgets should be kept to the minimum, whether in the form of TV or mobiles. Patient, then the last thing, the most important thing is regular exercise and yoga, which helps in one is the overall well-being of the patient and also for tackling insomnia. Then comes the medical management. When along with the medical management, we always put them on few medications. The few medications are the classical one being the clonazepam or alprazolam, which are used in a very low dosage. We always tell them it should be used in only few months, like 1 to 3 months and all, short term basis, because they develop tolerance, and after few months that drug might not act also. The other drugs which are being used commonly are zolpidem, which is a non-benzodiazepine agonist. So that is the very commonest drug. Then latest drugs have come like melatonin, which that melatonin is required for the normal sleep cycle. So that those are used in the form of tablets as well as spray. This melatonin spray is used as 2 spray below the tongue before 30 minutes of sleep. So holistically we have to see insomnia in terms of treating the coexisting diseases as well as insomnia per se in the form of non-medical management as well as medical management. So that overall, because if you are not treating insomnia properly, the primary disease also worsens. Like for example, if the patient is not having a proper sleep, there will be worsening of the heart failure, there will be worsening of the respiratory diseases, or worsening of the neurological function per se. Patient might end up with chronic insomnia and thereby will have lot of other side effects. So insomnia should be tackled as aggressively as possible. So, thank you.